Full mouth reconstruction. Many patients have actually seen the gradual decline of their teeth over many years, and we're probably normally talking decades here, where teeth have gradually been worn down because of grinding or clenching. Maybe they've broken some teeth, they've had some porcelain teeth done, maybe some restorations, perhaps they've even lost a few teeth here and there. And what they're noticing over time is that every time they go and see a dentist, there's always a new problem. Maybe they need a new crown, a new filling. And what happens over time as these teeth actually change and the mouth changes is a lot of the dentistry is done when the teeth have already worn down or they've already been damaged. And what's happening is the crowns have been done in a situation where the teeth are actually shorter than they normally would be, or perhaps the mouth has actually changed a lot where patients have actually lost teeth. Full mouth reconstruction means that what we're doing is we're restoring the entire mouth back to the most ideal bite and the most ideal aesthetics. So we're really looking at the patient from a cosmetic point of view, but also a functional point of view to ensure that their bite is actually ideal. When we're doing this type of treatment, what we're usually using is porcelain. We're using porcelain because we know that porcelain is around the same strength as tooth enamel, and we can use porcelain in order to reconstruct teeth best into the ideal position. When we look at a case, for example, like Brendan, who's actually come to see us, you can see that his teeth are very, very worn down. He's actually ground so much that he lost the enamel off his teeth probably about 15, 20 years ago, and by continuing to grind, he's gradually worn more of his teeth away. You can also see on the upper left-hand side, or upper right-hand side in this photo, he's actually lost one of his teeth. He actually was grinding so much that the teeth got so weak, the tooth actually ended up breaking, and he lost that tooth. So now he's got a missing tooth on that upper left-hand side. Full mouth reconstruction means that we could have placed a new tooth into that position. He's lost a tooth and we could put a new tooth in there. But when we see all the damage that has been done, it would mean that that crown that we would put in would be in a totally wrong position for him, because it would be basically in his ground down position. By using porcelain, what we've been able to do is actually build his teeth up into a new position. And this is very costly treatment, of course, because porcelain treatment is very costly to actually do. And by reconstructing the mouth, we're really working on all of the teeth. So usually we'd say to the patient that it's like the cost of having a new car. But for patients that have gone through the cycle of continually having treatment done, maybe a crown every year or a filling every year or losing a tooth here and there, what we're doing is building the teeth up so that we're looking at very, very long-term treatment that is really going to not only give the patient a perfect smile, but also the best bite possible. The other side of this treatment too, of course, is that there are some patients that have teeth that are so badly broken down to the point that it's really illogical to try and keep doing more and more dentistry to try and save the teeth. In these situations, if the foundations of the teeth are weak, or there's a lot of gum disease, or there's a lot of broken down teeth, or there's only very few sound teeth left, is that sometimes we look at replacing all of the teeth with dental implants using the all-on-4 dental implant treatment.